Sterilization pouches, sometimes referred to as sterilization bags, are specially made disposable packages used for storing sterilized instruments while maintaining the sterile conditions inside. They're low cost, easy to use, widely available, and come in many different sizes. But to function as they're intended, the practitioner needs to know how to properly use them. The FDA classifies sterilization pouches as Class II medical devices. Sterilization pouches have two surfaces. One is a medical-grade paper that allows the sterilant to pass through to the instruments and the other contents, and the other is a plastic film. In a body art facility, steam sterilization is the only form of sterilization done on site. However, many pre-sterilized instruments will have been sterilized with EO gas and shipped in special packaging. The properties of the paper surface change during sterilization. If a practitioner decides to re-sterilize an instrument, they must use a new pouch. They cannot be reused. Pouches are usually used for reusable metal instruments that have been through a thorough decontamination process. These instruments must be completely dry before being placed in the pouch. Non-sterile, single-use instruments may also be sterilized and stored in pouches because some single-use instruments are not always shipped pre-sterilized. Also, single-use items like gauze and cotton swabs may be pre-sterilized in pouches without any instruments. The manufacturers of sterilization pouches have instructions for use that need to be observed. For example, a pouch's IFU may require the pouch to be no more than 75% full or have 1 inch of empty space around the contents on all sides. These IFUs can all be found online. Most pouches are self-sealing with an adhesive strip. When using a self-sealing pouch, it's critical that there are no wrinkles in the seal. Pouches must be labeled with the sterilization date, cycle number, and the operator's name or initials. This helps with traceback in the case of an autoclave failure. Unless the manufacturer has communicated otherwise, labeling should be done on the outer edges of the pouch to avoid compromising the quality of the paper. The tab used for opening the package is the best place for this. Pouches should be sterilized on their sides, paper surface to plastic surface, oriented with the paper side up to allow for better drying during the dry cycle. Even better, they can be placed inside the rows of a rack made to fit inside the autoclave. It's critical that the autoclave is not overloaded with pouches. Too many pouches can prevent steam from penetrating each bag properly. The autoclave's operating manual will communicate what the limitations are. The correct setting must be used for the cycle type, and the autoclave's dry cycle must be allowed to complete before the door is opened or instruments are removed. Pouches should not be removed while moisture is still present on or inside the package. All sterilization packaging must have a color-changing chemical indicator. This verifies exposure to steam, which allows the practitioner to differentiate between packages that have been through the sterilization process and those that have not. However, these chemical indicators do not validate sterilization, which is why each autoclave cycle must include a Class 5 integrator. Integrators indicate that the parameters for sterilization, time, temperature, and pressure were achieved. These integrators can be labeled and kept with sterilization logs as part of the facility's record keeping. Integrators should be placed in the front of the autoclave near the door where they can be seen by anyone who opens it. Once sterilized, pouches should be stored in containers that can be disinfected and protects them from dust and moisture. If a pouch becomes wet while in storage, the inside contents can no longer be considered sterile. Sterile pouches should always be stored away from liquids to minimize the risk of splash or spills. If either the paper or the plastic sides of the pouch become torn or punctured, the contents are no longer considered sterile. The heavier the instrument is, or the sharper the tips and edges are, the more likely there is to be a strike-through. This can also happen if pouches are stored stacked on top of each other, or if practitioners are not cautious when handling them. The expiration of sterilization pouches is generally considered event-based. Most pouches do not come with an expiration date, meaning that as long as the pouch's integrity has not been compromised, the contents are still considered sterile. However, Some manufacturers suggest repackaging and sterilizing unused instruments after 1 year or even 6 months. Once the packages have been opened, fresh gloves need to be worn before handling the contents of this field. The outside surfaces of pouches are not considered sterile, so whatever dust or microbes are there are now on the gloves used to handle them. Similarly, we don't push instruments through the paper side of the pouch and grab them with those gloves. Once all instruments and products are inside the sterile field, we can don fresh gloves and perform our body art.